I'm Andrea Flores. June is Men's Health Month. It's a time we should all be encouraging our fathers, grandfathers, and friends to be getting a checkup. Joining me now is Dr. Manoj Bhupathi, an oncologist with the Sarah Cannon Cancer Institute at Health One. And doctor, we know men often overlook their health. What should they be doing to stay well?
Good morning. Thank you for having me. So men do often can overlook their health. Some of the things that we talk about or can think about are limiting alcohol use, increasing physical activity, limiting smoking, evaluating for risk factors for heart disease, as well as cancer screening, specifically for prostate cancer or even enlarged prostate.
And certain conditions are more common in men. What are those and how can they be addressed?
So men are probably more ailment to the cardiac risk factors as well as specifically prostate cancer. Those are probably the two biggest things that you tend to think of in men's health. Again, lifestyle modification for cardiac risk factors and knowing the signs of heart attacks is going to be very important, and important as well as following up for physical exams and knowing what nocturia or urinary symptoms, if they're occurring more frequently, and being evaluated for prostate symptoms is going to be important as well.
We know getting a screening is a crucial part of health exams. Which ones do you recommend for men?
So screening tests, routine physical exams should typically cover blood pressure, blood counts, cholesterol, most importantly, as well as a PSA, especially in men who have family history of breast cancer or even brothers or grandparents or fathers with prostate cancer themselves would be very important.
And last question, do you have any other advice or anything that men should be looking out for as they keep an eye on their health?
Yeah, I think the biggest piece of advice that I can give anybody is not to overlook any symptom that they cannot explain or ignore it. I think it's really important to be evaluated and know that something more serious is not underlying. So I think that's my sincere advice for most everybody.
Dr. Bhupathi, thank you so much for all of that useful information. For more on Men's Health Month and the Sarah Cannon Cancer Institute, just visit cbsdenver.com.